Yes, surgical menopause is instant and it's brutal because when both the ovaries are removed, the adrenal gland can't produce enough estrogen, progesterone, and testosterone. Now, estrogen is such an important hormone, it's like a lubricating hormone. So, when the ovaries are removed, before a woman has naturally gone through menopause, this is a shock to the body. And this is particularly worse if the person is below the age of 45 years old. The surgical menopause leads to a sudden and immediate drop in estrogen and all the other hormones as well, causing an onset of menopause symptoms that occur abruptly. So lack of sleep, hot flushes, night sweats, irritability, anger, rage, unable to concentrate, brain fog, memory issues. You literally think that you're going crazy and everybody around you doesn't realize that's because of the surgical menopause. Now, a lot of these symptoms can be managed, but surgical menopause does carry several risks beyond those of menopause. So if you are a young person, so below the age of 45, we know that there's a risk, actually even after the age of 45, we know that there's a risk of loss of bone density, so osteoporosis, low libido, also the risk of cardiovascular disease as well. And in younger women, we've also known that those that go through surgical menopause can get an increased risk of cognitive impairment and dementia and Parkinson's disease. You can manage your surgical menopause symptoms through lifestyle changes that can help reduce stress and alleviate pain. There's lots of exercise and holistic things. But before having your oophorectomy, so a removal of your ovaries, please discuss all your HRT options and which doctor is going to start HRT. In the NHS, the system is siloed. So the gynecologist who might be doing your surgery for all the right reasons and the risks and benefits I discussed with you might not be the person that's prescribing you hormone replacement therapy. Also, depending on why you've had the surgery, could mean that they probably aren't able to make that decision about starting your HRT, and so therefore refer you back to the GP. And therefore, actually, the GP might not have the tools and all the information. So in fact, what we should be doing is referring patient to the menopause clinic. But as we know already in the NHS, that could be a really long way. So this is the British Menopause Toolkit that I would recommend everybody looking at, because that toolkit is what you should use to guide you and tell people who's looking after you, so your doctors, your gynecologist, your oncologist, maybe your GP, to say this is what I'm entitled to, and the management plan for surgical menopause. I know it's very disjointed, but I hope it helps. And I'm wearing glasses because I'm trying to distract myself from the fact that I've got lots of blemishes and I'm breaking out in spots, but I hope that's